So you must remind yourself throughout this ordeal of the good news. There's no question that our self-distancing is flattening the curve, so the accumulation of cases are spread out over time. Now, you're still going to hear about the growing number of infections, but as that occurs, we should see the fatality number go down. But on the drug front, there's also promising news there. Knock on sanitized wood. Researchers are reporting on a combination of anti-malarial meds and antibiotics, which were prescribed to COVID patients and saw a significant reduction in the viral load in them. Meanwhile, anecdotal evidence straight from patients' mouths are attesting to its success. Here's actor Dae Kim, who got the virus and then got the drugs.
And here's what I consider to be the secret weapon: hydroxychloroquine. Yes, this is the drug that the president mentioned the other day. It is also the drug that Dr. Anthony Fauci cautioned us about. He said that evidence that the drug was promising is anecdotal, and that is correct. It means it wasn't studied and it's only based on personal accounts. Well, add my name to those personal accounts because I am feeling better.
That's good news for him. So how did the media respond to all this? Well, because Trump had touted the drug on Twitter, what do you expect? MSN published a Bloomberg News piece with the headline, "Virus drug touted by Trump can kill in just 2 grams." Neglecting to point out that 2 grams of a lot of things can kill you, trust me. Once again, the media, who love to tout their faith in science, flunk remedial math. Screw them. Back to the good news. If we can treat people and reduce mortality even more, then not only can we save lives, we can also save our economy. So yeah, it might get scary, but hopefully the good news should soon overtake the bad. So first, we had to divide. Now, fingers crossed, we will conquer. So, hey, Dana, I'm going to ask you a nerdy question.
Okay.
It's so weird. You're not next to me. It's very strange. All right. So
Do you miss me?
Yes, I miss you. I'm alone, except for Jesse's above me, as usual. So we need these
towering above you.
Yeah, we need these clinical trials so we can tell if people just aren't getting better on their own, because a lot of people do get better on their own, and you have to compare groups, placebos, with the group that got the drug. But then that poses an ethical question, because if this drug is working, do you want to be in the placebo group? I don't know. Say it was a nerdy question.
That is a nerdy question and a good one. And thankfully, there are doctors that are working on this. Though I'm hopeful, right? That if this works and we know that the drug can be made, if it works, I mean, great. And I'll be patient and wait for people. But I do want to mention one thing, Greg. Talked to a friend of mine this weekend who's a doctor, has many patients that called him over the weekend. These are pretty wealthy people demanding that they be given this drug,
right,
so that they could have it in their bathroom cabinet just in case they maybe get COVID-19.
It's terrible.
And they want to take care of themselves. First of all, you're asking your doctor to do something that's unethical. And second, you are preventing someone who really need it, who could get better from it, from having it. And that, of course, then you could have a supply and demand problem with the cost. So let's hope that this works. But everybody, if you are wealthy and you think you want to stockpile this stuff, knock it off.
Yeah, it's that inclination that I got the money, I'll just throw money at it and I'll be safe. You know, Dagan, you see Fauci was cautious about this and Trump is optimistic. And I always feel like it's the 2 sides of the same coin, and that Fauci has to be the cautious voice and Trump has to be the cheerleader, but they're kind of going in the same direction. I think a promising one.
No, they are going in the same direction, and there's so many other promising therapies that are under development. We've talked about Regeneron. It has a monoclonal antibody drug. It developed a drug for Ebola. It's got a product in the works. It could be out or ready by this summer. Some ideas being thrown out are these trials that you should have multiple therapies in the same large trial and even scale up manufacturing before we're sure they work. So for all the people who've spent years vilifying biotechnology and pharmaceutical companies, they will save the day and save the economy. And we should be thankful we live in this country with such a healthy drug development regimen.
You know, the good news, I think, Juan, is that all of the dire predictions that we've been hearing about don't factor in the human creativity and the human innovation that come out of these companies and come out of individuals just by self-distancing. You being far away from me is saving lives.
I never thought of it that way.
Yes.
But it could be.
Yeah.
But I must say, I just am delighted that we see this kind of potential for innovation. I think it's what really is going to, be miraculous. I just think we have so many smart people, so many committed people trying to come up with answers. I mean, it's difficult to take on a virus. Like if they give you Tamiflu, Greg, you have to take it within the first few hours of the symptoms. So if you get something now and then you have to give it to people, it's, there's so much to be determined. What does worry me is when I see the president, he tweeted out recently, we don't want the cure to be worse than the illness or the problem. And there were reports in papers that he's getting tired of all the medical experts, saying we need the social distancing. We can't just have everybody rush back, because he's right in thinking, well, but what about the economy? How far do we go with this before, at the risk of having our economy shut down? But I do think at this juncture, I hope the president, even as you describe it as cheerleading, I hope he would understand that you got to listen to Dr. Fauci, to the Surgeon General, Jerome Adams, and others who are experts in the field at this moment, because I think this is, right now, at this moment, I would say a medical crisis.
All right, Jesse, what are your thoughts on this? Are you optimistic?
I'm optimistic, and I'm also realistic. This country was hopeful after Pearl Harbor, after 9/11, after the Great Recession. We can still be hopeful now during the pandemic. There's nothing wrong with that, and everybody assesses risk differently, whether it's experimental drugs or social distancing. That doesn't make people that are optimistic bad people. Not everything has to be a doomsday scenario, and we're seeing positive signs, like Apple, for instance, is donating 1 million masks. We've mobilized the National Guard to build MASH units. They're sending a Navy ship that has a hospital inside of it to New York Harbor next week. Am I saying everything's perfect? Absolutely not. We need to ramp up the Defense Production Act to get these masks, these ventilators, and hospital products out there as soon as possible. We need more testing desperately in this country. Perhaps we issue war bonds so the consumer can be more confident. But looking back afterwards, because this is going to be over, we're going to see ourselves in a whole new way. We got to cook our own food, spend time with loved ones, maybe explore different things that we hadn't really thought about. And we're going to come out of this okay.
What did you explore?
That's a personal question, Gutfeld. But we are going to come out of this okay.
I think you're right. All right.